Good afternoon, my name is Adriana. This is my Explain Describe speech for my public speaking course. I do have a live audience of at least 5 people. They're all adults, I promise. Awesome. And so, narcolepsy, I'm sure you've heard of it, but have you heard of hypersomnia? Hypersomnia is something that doesn't affect a lot of people, so your friends and family may not have it, but knowing more about a medical condition that other people don't know about helps you gain empathy for those around you. I am speaking about this today because I personally have had hypersomnia for 8 years, and I think it's an important topic that people should know more about. Symptoms of hypersomnia, according to the Cleveland Clinic, includes a few things that are specific to this medical disorder, such as daytime sleepiness. If you sleep more than 10 hours a day and you are still just as tired as if you hadn't had any sleep, and that happens 3 or more times a week for multiple weeks in a row, that's signs of a sleeping disorder. You also have take daytime naps, but after those naps you do not feel any more rested than you did before you took the nap. And you may fall asleep unexpectedly throughout the day while you're in an idle position. 5% of people in America deal with hypersomnia. Interestingly, 5% of America also deal with bipolar disorder, and the crossover rate of that is 25% of people with bipolar disorder deal with hypersomnia. And that is a statistic found in the efficacy of transdiagnostic sleep intervention for outpatients. According to Dr. Bolu in PubMed Central, hypersomnia differs from narcolepsy in that daytime sleep that you experience, you do not enter the REM sleep, which people with narcolepsy do enter into. Other things that you may deal with as having hypersomnia that are comorbid with other disorders are things like brain fog, headaches, or confusion or lack of concentration. So that sounds a lot like depression, but whenever you add everything together, it all could add up to something like a sleeping disorder like hypersomnia. Treatment for hypersomnia, there is none. So there are some doctors who believe that pharmaceutical interventions such as taking a medication like Ambien could help, but overall there is a lot of pushback in the medical community for prescribing sleep medication. Treatment, also according to the efficacy of transdiagnostic sleep intervention for outpatients, says that a combination of cognitive behavioral therapy, which you could also find for those outpatients who have other disorders outside of hypersomnia, and helping get better sleep hygiene, can combined help mitigate the consequences of hypersomnia, but there is no treatment that leads to a cure or a treatment that leads to just the lack of symptoms overall. The only hope is mitigation. So, I hope that today helped you learn a little bit more about hypersomnia and helped you gain some empathy for those around you who may be dealing with sleep disorders that are not known a lot about. And thank you so much for listening. Have a wonderful evening. Thank you.